All right, I'll be opening it up to attendees in just a minute or two. So we'll be able to get started at 1 p.m. Eastern.
Do you want me on the screen, Deb and Vidya? Do you want to have me just come on just when you need me to? Deb, you're muted.
Just when you need to.
Perfect.
You can relax. Relax.
Yay, thank you.
All right, I'm going to open the webinar to let people start joining. Good luck, everyone.
See.
Hello, welcome to everybody who's joining us. Thanks for being here. We're just going to wait just another minute for anybody who wants to still come on, and then we will get started. Okay, I am going to get started and let people continue to join in as we go. So first, my name is Marcia Ellison. I am a white-skinned woman with brown hair, glasses, and a blue sweater on. And I'm very pleased to meet all of you and have you join our webinar on this new project, exciting new project being given by the National Institute on Disability, Independent Living and Rehabilitation Research to the University of New Hampshire. The title of the The grant is a framework for investigating living and working with disabilities and long COVID. You're going to hear a good bit about that project today. So first, I want to acknowledge that this webinar is being hosted by the Center on Knowledge Translation for Employment Research sector, affectionately called sector. We are also a knowledge translation center funded by NIDLR. This is our acknowledgement slide. And we are here to offer you technical assistance with your NIDLR-funded employment projects. If you need some help with your knowledge translation, please do contact us at our website at sector.org, and our technical assistance page URL is up there as well. We can provide assistance with planning knowledge translation activities, identifying audiences, and other knowledge translation approaches to your work. And we are really delighted to be able to host this webinar for the University of New Hampshire. So some quickie webinar housekeeping notes to make. This webinar is being recorded. We will post it on YouTube and let you know that it is available at the time. We are going to have a question and answer period at the end, so you'll see a Q&A button on the bottom of your screen. Use that to send a question. As we're going through the presentation, feel free to post questions and we will address them at the end of the presentations. Also, live captions are being auto-generated by Zoom. There's an icon to enable them at the control panel at the bottom of your Zoom window. All you as a participant are automatically muted with your webcams off. And this is an email for D. Logan at umassmed.edu, and she is there available to you if you're having any technical difficulties, or otherwise, please do just put it in the chat. Okay, so our agenda is to first hear introductory remarks by the NIDLR director, Dr. Anjali J. Forber-Pratt, who we are very delighted to have here in attendance with us, as well as Hugh Berry, who is also the project officer for this new grant, is also from NIDLR and in attendance with us. You'll be hearing from Shreya Paul and Debra Brucker and Vidya Sundar on various aspects of this new grant. So with that, I'm very delighted to introduce Dr. Forber-Pratt. We have all been, as NIDLR grantees, very grateful for her leadership over these past few years, taking us all through the very difficult COVID time and keeping NIDLR and our grantees well and alive. And so with that, I turn it over to Dr. Forber-Pratt.
Thank you so much. Well, as you heard, my name is Dr. Anjali Forber-Pratt, and I am the director of the National Institute on Disability, Independent Living, and Rehabilitation Research, also known as NIDLR, within the Administration for Community Living. For those who don't know, we are the federal government's main applied research entity that's focused on disability research. Today, I'm wearing a purple shirt and a gray blazer, and I'm not seen on screen. I'm sitting in a manual wheelchair, and I have brown skin and long black hair and a ponytail. Given the novelty of the long COVID experience, building a research base is so important to systematically capture experiences and impacts on employment and community living. And this research base is really only beginning to exist for long COVID and is largely absent for individuals with disabilities who are also experiencing effects of long COVID. We know, too, that long COVID can be a disability if it substantially limits one or more major life activities. At NIDLR, just as a little bit of context of how we came into this long COVID space, I helped to lead the writing of a section of the National Research Action Plan on Human Services Supports and Interventions, specifically on long COVID, that was published in August of 2022. At that time, much of the research was focused on basic science questions and clarity on the diagnosis of long COVID itself. And this report really illuminated the paucity of research in this area, but we knew that this research was going to be important more than ever for us to be involved in. At the time, there was only a couple US-based studies that I could point to from NIDLR and also from the US Department of Labor, but not much else. So I relied heavily on something that we at NIDLR believe wholeheartedly on, which is that input from people with lived experience matters and must shape the directions of research at every step. So I included publicly available quotes from people with the lived experience of long COVID to emphasize what those research gaps were that we were seeing or were anticipating. And this was an incredibly wonderful way to weave that lived experience in and throughout that entire report. We really felt like researchers in the field of disability and rehabilitation needed to be leading the way of this important long COVID research. And we know more about the challenges of employment for those with disabilities writ large in terms of accessing medical care, coordinating services for complex needs and employment needs. But in the context of long COVID, less was and is known, and we needed to rely on the research base that we did know and to be informed from that broader field of disability and rehabilitation. Coincidentally, the early NIDLR-funded grants related to employment and long COVID. And so our investment on this critical part of long COVID research really emerged from the work that the field was proposing based on what was known and what was unknown. So NIDLR is funding research projects to help to develop and test interventions aimed at improving cognitive functioning and employment among people with long COVID. So we have 2 of those grants, one at the University of Alabama, Birmingham, and one at the Shirley Ryan Ability Lab. And then in July of 2023, we issued a grant call specifically on promoting positive employment outcomes among people with disabilities who are experiencing long COVID, which led to a 5-year grant awarded to our wonderful colleagues here today at the University of New Hampshire, living and working with disabilities and long COVID, which we're kicking off here in this webinar. You'll be hearing so much more about that topic today, so I won't say too much more other than saying that we are just thrilled to be funding this important work. But one last piece, in parallel to all of what NIDLR has been doing, in parallel to that, across the government, a long COVID coordinating council was formed to continue cross-government collaboration on this topic, which grew into an Office of Long COVID and Related Conditions that exists within the Department of Health and Human Services. Dr. Hugh Berry, our NIDLR project officer for all of our long COVID grants, and I actively participate in these cross-governmental meetings to make sure that the long-term impacts and outcomes of those who experience long COVID are not forgotten, and that the research findings of the work that we are funding are shared at the highest levels across the federal government. While there is very little research as of now regarding the impacts of long COVID on people with disabilities and how these impacts influence employment outcomes, we are growing and building that research base with your help. So thank you so much for your interest in this topic and for being here today to learn more from these wonderful researchers at the University of New Hampshire, Dr. Sundar, Dr. Brucker, and Ms. Shreya about this particular project and how they will be carrying out this important work to investigate living and working with long COVID. And with that, I'll turn the things back over to you.
Thank you, Dr. Pratt. And Ms. Paul is getting her slides together and we'll begin the presentation.
Hello, everyone. My name is Shreya and I'm a project director at the Institute on Disability at University of New Hampshire. And I'm very excited to be a part of this webinar where we are presenting a framework for investigating living and working with disabilities and long COVID. I am an Asian woman with short black hair, wearing glasses and a pink blazer against a blue Zoom background. And I'll start with some acknowledgements. The contents of this presentation were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. NIDLR is a center within the Administration for Community Living, Department of Health and Human Services. The contents of this presentation do not necessarily represent the policies of NIDLR, ACL, or HHS, and you should not assume endorsement by the federal government. In the next few slides, I'll be talking about the prior research that we have conducted on COVID-19, the ongoing research on long COVID and disabilities. So prior research, which Dr. Debra Brucker, I, and Dr. Houghton will have conducted around COVID-19 has highlighted the impact of COVID-19 pandemic on the employment status of people with and without disabilities. From February 2020 to April 2020, the percentage employed dropped from 31.1% to 26.4% for people with disabilities, and from 74.8% to 63.2% for people without disabilities. This slide shows the estimated monthly percentage distribution across employment statuses by disability status. And we see that the percentage unemployed rose from 3% to 6.5% for people with disabilities from February 2020 to April 2020, that is the peak COVID-19 months. And it rose from 2.9% to 10.5% for people without disabilities. We did not notice any significant changes in the percentage not in labor force for people with disabilities. However, for people without disabilities, the percentage not in labor force rose from 22.3% to 26.3% in April 2020. In the succeeding months, percentage employed generally increased, while the percentage unemployed decreased for both people with and without disabilities. My work with Dr. Debra Brucker also investigated the reasons for not working during the COVID-19 pandemic among working age people with and without disabilities. We conducted this research using the Household Pulse survey between April 2021 and May 2022. And this is what we found. We found that compared with people without disabilities, people with disabilities had significantly higher odds of reporting that they were sick with coronavirus symptoms. They were caring for someone sick with coronavirus symptoms. They were concerned about getting or spreading coronavirus symptoms. They were sick or disabled. They were laid off or furloughed due to the coronavirus pandemic. Their employer went out of business due to the coronavirus pandemic. They did not have transportation to work, and other reasons for not working. Persons with disabilities had significantly lower odds of reporting that they did not want to be employed and that they were caring for children not in school or daycare than persons without disabilities. Our center is continuing to monitor the employment to population ratio, and this slide presents the current statistics on employment to population ratio about people with disabilities. And in October 2023, 37.2% was the employment to population ratio for people with disabilities as compared to 35.5% the prior year. So the next few slides will present the existing research about long COVID. But before that, I would like to describe what is long COVID. So according to Centers for Disease Control and Prevention, people with long COVID have a range of new or ongoing symptoms that can last weeks or months after they are infected with the virus that causes COVID-19, and that can worsen with physical or mental activity. So examples of common symptoms of long COVID include tiredness or fatigue, difficulty thinking or concentrating, shortness of breath or difficulty breathing, headache, dizziness on standing, fast beating or pounding heart, chest pain, cough, joint or muscle pain, depression or anxiety, fever, loss of taste or smell. So a report published by the Kaiser Family Foundation in 2023 highlighted the prevalence of long COVID. According to the report, as of January 16, 2023, 15% of all adults in the United States reported having had long COVID symptoms at some point, and 6% reported current symptoms. Although a smaller percentage of people with COVID reported having long COVID, 5% of the adult population is struggling with activity limitations from long COVID. What do the latest data show? So according to the report published by KFF, which used data from the Household Pulse survey, among people who have ever had COVID, the share who say they currently or have ever had COVID, long COVID, declined from 35% in June 2022 to 28% in January 2023. The percentage of people who have had COVID and currently report long COVID symptoms also declined from 19% in June 2022 to 11% in January 2023. The Household Pulse survey also asked people who report having long COVID whether it limits their day-to-day activities, and most people with long COVID report activity limitations. Many people with long COVID have activity limitations, but most are not significant. This is, among people with long COVID, 79% report having limitations to their day-to-day activities, and 27% characterize the limitations as significant. Understanding the severity of limitations and whether they are permanent is relevant to the uncertainty surrounding how long COVID will affect employment. The report further states that estimates of the effects of long COVID on the workforce range from 500,000 to as much as 4 million. A report on what are the implications of long COVID for employment and health coverage by Kaiser Family Foundation, released in 2022, also states that long COVID involves a range of potentially disabling symptoms and may affect 10 to 33 million working age adults in the United States. The prevalence of long COVID is uncertain, with studies finding that the percentage of working age adults with COVID who develop long COVID could be 10%, 20%, or 33%. If we conservatively assume 100 million working age adults have been infected with COVID, that implies 10 to 33 million may have long COVID. Surveys showed that among adults with long COVID who worked prior to infection, over half are out of work or working fewer hours. That is, 25% are out of work and 31% are working reduced hours after long COVID. Many conditions associated with long COVID, such as fatigue or the inability to concentrate, limit people's ability to work even if they have jobs that allow for remote work and other accommodations. In comparison, among all working age adults in 2019, only 7% were out of work. Given the sheer number of working age adults with long COVID, the employment implications can be profound and are likely to affect more people over time. One study estimates that long COVID already accounts for 15% of unfilled jobs. There is another qualitative study by Stelson et al. Explored the return to work experiences of people living with long COVID. Participants described how fluctuating symptoms made worse by work-related tasks made returning to work challenging. Participants' ability to work was often predicted on job accommodations and support. Non-work factors were also essential, such as receiving a long COVID medical diagnosis, which was key to accessing leave and accommodations and help at home to manage non-work activities. Many participants described barriers to accessing these supports, highlighting stigma and disbelief in long COVID as a medical condition as one of the barriers. There is limited information available about how long COVID is impacting living and working for people with disabilities, and our proposed research tries to address these gaps. I will now pass it on to Dr. Debra Brucker.
Thank you so much, Shreya. I am Dr. Debra Brucker. I am a research professor at the Institute on Disability at the University of New Hampshire. I'm a middle-aged white female with brown hair wearing a green shirt. And I'm here to provide some overview of the projects that we plan to undertake. This is a 5-year grant that was designed to increase our understanding of how people with disabilities who have long COVID are navigating both living and working. Based on the information that Shreya shared earlier, you can see the importance of the work that we are planning. We have a research team that will heavily include an active advisory group that includes persons with disabilities who have long COVID and other stakeholders, as well as researchers at the University of New Hampshire, including myself, Dr. Vidya Sundar from the Department of Occupational Therapy, Shreya Paul, who you just heard from, Eugenia Okada from the Health and Human Services librarian at our college, and a group from the Institute for Health Policy and Practice, including Amy Costello, Erica Plant, Bethany Swanson, and Chris White. And we also have partnered with the Kessler Foundation, a rehabilitation research organization that's based in West Orange, New Jersey. So we're planning 5 projects in total, beginning with participatory action research, in which we'll be conducting 3 different focus groups. One that includes people who are current employees with disabilities who have long COVID. A second group, which includes former employees with disabilities who have long COVID, so people that were not able to retain or sustain employment upon acquiring long COVID. And a third group that includes stakeholders that support the employment for persons with disabilities. This might include supervisors within employers. It might include vocational rehabilitation experts, other rehabilitation professionals, etc. And the purpose of these groups is to help us refine our research questions and aims and gather some information about people's experiences with accessing healthcare, as well as navigating workplace issues with long COVID. The second project is a project that will be looking at the risk of long COVID using nationally representative household survey data to examine individual characteristics that might be associated with a risk for long COVID among persons with disabilities. We'll be using data from the National Household Interview Survey to conduct this study, which is conducted by the Centers for Disease Control and Prevention. And they have recently added in 2022 questions about long COVID that we will be using to do this analysis, specifically among people with disabilities, including people with all different types of disabilities and ages and races and genders, ethnicities, different income levels, different geographies, etc., to try to glean some information from that data set. And you'll notice as I talk through these projects that given that there is a lack of information about long COVID for people with disabilities, we're really trying to take a mixed methods approach using some qualitative research as well as quantitative research and different types of existing data sets to try to gather what information we can at this point as research on long COVID is really beginning to evolve. Our third project, we will be examining patterns of medical care for people with disabilities who have long COVID using Massachusetts healthcare insurance claims data to examine healthcare treatment patterns for people with disabilities who have long COVID. If you're not familiar, many states have all-payer claims databases that can be used for research, and that would include information about not just Medicare and Medicaid claims, health insurance claims, but private coverage as well, so that we can look at patterns of care for people with and without disabilities and look at comparisons and disparities and see if there's information that would be useful for informing policy and practice in terms of healthcare for people with disabilities who have long COVID. Our fourth project, which we'll provide a lot more information about shortly, is our job crafting intervention. Here we'll enroll a diverse group of 50 employees, 25 employees with disabilities and long COVID, who will receive an 8-week intervention, and 25 healthy employees without long COVID or disability who do not receive an intervention to examine changes in work engagement, work performance, etc. Dr. Vidya Sundar will provide more information about our prior research where we use job crafting among people with disabilities. This was before COVID, and found some positive impacts, and she will share the findings from that study and talk about why we think this may be relevant for people with disabilities who have long COVID and some of the challenges they may face given the symptoms that they may experience. And then our last project, which we will probably do closer to the end of our 5-year bunch of projects, is a systematic review where we will systematically search for and synthesize existing research on long COVID and disability, thinking that there will be more research that is published at that point that we can synthesize and help to inform the field going forward to support this population. So I will hand this over now to Dr. Vidya Sundar to talk a little bit more about job crafting among workers with disabilities.
Excellent. Thank you so much, Deb. So like Deb mentioned, I'm going to be talking about our past research, By the way, I am Vidya Sundar. I'm a faculty member in the Occupational Therapy Department of the University of New Hampshire. I identify as female. I'm of South Asian origin. I have medium dark skin, black hair, and I'm wearing a colorful print top with a navy blazer. So our current planned projects for the living and working with long COVID was really had its foundation grounding in a previous research that was also funded by NIDLR, a field-initiated research that looked at how individuals with disabilities might manage their own career and how they can achieve positive employment outcomes through a strategy called job crafting. And I'll talk about that in a little bit. So before we go into details about what job crafting is and how the intervention is structured, I want us to think about, how we go about our day-to-day work. If you think about what we do at work on a daily basis, it really comes down to three components: what we do, who we do it with, and then what we think about it. Now, if I can use me as an example, I'm a professor in a university. What I do is teach, I do research, and I participate in service activities within my university. So the tasks, the actual things that we do on a daily basis, that's a task component. And who I do it with. So I interact with students, I interact with my colleagues. You've seen two of my wonderful colleagues here. So there's the group of people that I work with on a daily basis. And then how I think about it. Now, we all know that when we get up in the morning, there are some days that we feel like really energized and ready to take on the world. And then there are other days that we feel drained and we might feel, a little deflated in terms of, oh my God, I can't believe I have to do all these things today at work. So if you think about our work, it's what we do, who we do it with, and then how we feel or what we think about the different things that we do on a day-to-day basis. Now, within the job crafting world, the common outcomes that researchers are interested in, it includes engagement in work, which is feeling a sense of deep involvement, which is feeling invigorated by your work. And it helps build identity. It serves a self-fulfilling purpose. It makes you feel good about yourself. And also the social interactions that happen at work that help buffer some of the stressors at work. And then in the long term, what we do at work and how we think about it, it impacts our job retention and our long-term job tenure. So I'm actually going to come back to this slide in a minute. So if you think of a formal definition for job crafting, it is the process by which individuals might be redesigning or reimagining our own jobs in a bottom-up fashion. And that means that it's not something that's planned. It doesn't always have to be planned. And it doesn't come from, your supervisor telling you that you need to do X, Y, and Z. It can be an innate or an acquired skill, which means that I like to compare a job crafting skill to lifestyle management skills, right? There are some of us who are really good at making sure that the calories that we consume are balanced by our day-to-day activities, and others need help with it. So job crafting can be something like that, where people inherently know that this is how they want to shape their career and shape their day-to-day job tasks. And they kind of can create a pathway for themselves, or it can be something that is coached, facilitated by someone, an outside expert. Now, our previous research through the NIDLR grant and some other research has shown that people with disabilities in general craft less than people without disabilities. And they also use less of what we call promotion-oriented crafting rather than, they use less of promotion-oriented crafting and tend to use more of prevention-oriented crafting. Now, this is an idea that we're still exploring. We have anecdotal evidence of it, And we're looking forward to explore more of this idea in this grant. So when we think of promotion-oriented crafting, what it really means is taking advantage of opportunities that expand your career boundaries. That could be learning new skills, making new connections, taking on new initiatives, versus a prevention-oriented approach focuses on sort of maintaining status quo. That's not a bad thing. And sometimes that's a necessary thing, because when you have a disability or a chronic condition, managing your symptoms and managing your medical appointments and managing your day-to-day tasks can feel like a lot. And sort of that preservation mode is what's referred to as prevention-oriented crafting. Let's see. Okay, so when you think about how individuals with disabilities may use job crafting, one example would be using assistive devices, right? Which is they're doing their job tasks, they're meeting their job demands and requirements, but they're doing it a little differently than a peer member, for example. Relational crafting may include examples where they seek mentorship opportunities, they seek out opportunities where they can work with a team and hone in new skills. Or and the last one, cognitive crafting, could be when they think about mundane jobs in a different way. They're engaged in sort of reframing how they feel about their day-to-day tasks. Okay, so with that as a background, I'm going to start describing what we did in our field-initiated study. Our overarching goal was to test the efficacy of a 5-week coaching-based intervention. Like I said earlier, this was an approach where we used job crafting sort of as a tool that we facilitated individuals with disabilities to think about how they might use job crafting to improve outcomes related to engagement and work performance. So our overarching questions were looking at the impact of job crafting on self-efficacy, on work performance, and work engagement, specifically for people with disabilities. And then trying to understand at a more basic level, how do they even craft? Is it different from what we see in the literature about people without disabilities? And what types of things do they do? Do they do more of task crafting? Do they do more of cognitive crafting, etc.? And our definition of disability was really broad. It included anyone who had a limitation, who experienced a limitation as a result of a health condition or any other diagnosis. So our design was a mixed method concurrent design, which means that we use both qualitative and quantitative data to answer our research questions. We used convenience sample recruited by word of mouth, and all of this happened right when the COVID pandemic broke. We started before the COVID pandemic, but we had to work through the pandemic to complete recruitment of our participants. Our participants were mostly 18 to 64 years old. They experienced physical and mild cognitive disabilities, and they had to be employed for at least 10 hours a week and actually not participating in a workers' compensation program. That was one of our exclusion criteria, and not have a diagnosis of psychiatric conditions or anything that might limit their ability to give informed consent. So our data collection timeframe was that we, as with many experimental intervention studies, we started with a phase of figuring out if participants meet our eligible criteria. We, collected some baseline measures, and this took about, a week or sometimes 10 days for some participants, a couple of sessions over 10 days, I should say. And then we launched into the intervention phase, which really lasted 5 weeks. They started off completing a job crafting exercise. Now, this is a commercially available tool through the University of Michigan. We had participants our research staff walk participants through that tool where they would break down what they did on a daily basis. They would say, this piece of my job, I really like this one. I can't wait to, move away from this. This one I could tolerate. So they would sort of tag different aspects of their job based on what they're passionate about, what they need help with, what matches their skills, etc. And then once we take it apart, we also put it back together, but in a slightly different format. And we have them think about what would your ideal job look like? So it's kind of like deconstructing, Lego pieces and then putting it all back together. But now you have a slightly different version of your day-to-day job tasks. And then we help them go through a process of, okay, so this is where you are now, and this is where you would like to be. How can we facilitate that transition process, keeping in mind that there are some parts of our job that we can't walk away from? I can't say I'm not going to teach. That wouldn't be acceptable. So there are some parts of our jobs that are negotiable, and then some parts of our job that may be, more amenable to changes. So we had to be really careful about when we help individuals recraft their jobs, think about what is their essential job function and how do we preserve that core, but also help them find ways of doing things differently so it's more meaningful, so it's more, they don't have any access issues, etc. So once that process is done, we set up a goal set. We went through a goal setting process where they used a goal attainment scaling method, and they came up with specific goals that they would like to accomplish over the course of the next 5 weeks. Sorry. So these are our participant demographic characteristics. As you can see, most of them were between 25 and 54 years old. About half of our participants were female, and they varied in terms of their education and work experience. So here are some of the goals that our participants set. I will probably call your attention to a couple of things. So increase visitor engagement by developing orchid or mushroom education program. So this was someone who worked at the Audubon, and they're obviously talking about task crafting, doing their work a little differently, while it's still aligned with their overall job requirements. And another one here, I will delegate tasks to other members of my team to reduce my workload. This could be thought of both as relational and task crafting. So one has more of a promotion expansion lens to it, and the other one is more of a contraction preservation lens to it. So our findings were, so I'm going to show you a couple of slides that shows preliminary findings from our previous study, and then I'll tie it back to how it relates to the current projects on long COVID and disabilities. So if you just look at how individuals progress through their goals, each participant had set anywhere between 2 to 4 goals. On average, you see that there was an increasing trend. And the way the goal attainment scaling is set is it goes from negative to this is sort of like their as expected progress. Many of them were able to go above their expected level of goal. Here is another quick slide that shows changes over the 6 weeks for 3 of our standardized outcomes: self-efficacy, work performance, and work engagement. They seem to, if you just look at the overall trend lines, they seem to start at this level. It sort of goes up, dips a little, and then sort of stabilizes for some and then goes back up a little bit. That seems a little intriguing for us initially, but it makes sense because when you are trying to do things differently at work, there is an initial ramp up, and then reality hits, or you have to, sustained changes can be more challenging beyond the first couple of weeks. And we think that's what we're seeing here as individuals are trying to sort of, tweak how things are doing. They find there may be finding some challenges in sustaining those challenges. And then they eventually, catch up to a slightly higher level. oops, sorry. We also did some growth modeling. So the previous slide I showed you was just looking at the outcomes without controlling for any of the, outcomes. But this one really looks at after controlling for some, disability status, after controlling for how much of goal attainment you were able to achieve, and you parse it out to individuals who were able to make a lot of progress, make an average amount of progress, and then make no progress at all. If you look at the red trend line here, so the individuals who were able to make a lot of progress in their goals, their self-efficacy went up. Whereas the ones who did not make any progress, their self-efficacy went down. So this is something that we're continuing to analyze the data and looking at other outcomes based on clusters of individuals who had different levels of goal progress. So in general, we were really encouraged by the results that job crafting has a potential to help participants feel reinvigorated about their own jobs by reimagining and redrawing boundaries of their job tasks. And the approach that, thinking about things that energize you and motivate you, that seemed to have really struck with many of our participants. And, anecdotally, many of them talked about how they felt really good about thinking about the positive aspects of their jobs. We also noted that there were both disability and non-disability related goals, which was a little surprising to us initially. But then it makes sense because when we work with individuals with disabilities as researchers, sometimes we can have a little bit of a tunnel vision, but really people's jobs are about their experiences related to disability, and then lots of things that are not related to disability. So this approach allows us to embrace both those aspects of people's jobs and think about it holistically. We have the usual sort of limitations that comes with preliminary research studies. Regardless, we found that this was a really new way of thinking about helping individuals with disabilities flourish and thrive in their work that takes both a approach to meeting their needs in terms of accommodations and what they do, but also thinking about what energizes them and what brings them sort of positive motivations and positive experiences. And that sort of ties us back to this current grant, which is looking at positive outcomes for individuals with disabilities and long COVID. So the way we approach it is thinking about positive work experience that then lead to positive outcomes of engagement and self-efficacy at work. So I will stop there. I'll pause there. That is our contact information, the three of us that you heard from. And I do want to remind folks that there will be a poll asking for feedback. Please take a few minutes to complete that, and we will open it up to Q&A right now. So Dee and Marsha, can you help walk us through the Q&A process?
Yeah, so we have a Q&A button, so folks, please type in your questions that you have for any of the presenters, and we'll be able to answer them and moderate them from there. I guess I had a question, if that's okay, while people might be typing. Oh, this looks like something came in from Erica Jablonski. Shreya, this may be more for you, but I'm not, well, no. She's asking, were there structural aspects of jobs that were related to more or less goal attainment, occupation, industry?
Yeah, sure. I can answer that one. So we did not analyze goal attainment based on occupation or industry, but we know from research on job crafting with on people without disabilities that jobs that allow for a little bit of autonomy in how you do things, those tend to be more conducive for this approach. Now, if you're in a job where you have very structured days, I can think of, a warehouse setting or a factory setting where your task and how you do it is highly, highly structured. It can be a little difficult to implement job crafting. Although I will say in those kinds of jobs, cognitive crafting becomes really, really important because people don't see the value in what they do because it's so highly structured. We all like our jobs when there's some freedom, some autonomy in how we do things, not necessarily what we do, but how we do things. So jobs that allow for that little bit of autonomy tend to be the ones where people can actually craft and then they are able to attain the goals. The other piece that I didn't talk about much is probably support from supervisors and coworkers, because again, if that's rigid and it can be constraining in some situations, it can be harder to achieve those goals. That's a really good question, by the way. Thank you for asking that.
You're getting a thumbs up. Yes, so I was curious, and this may be a question for Shreya, potentially. When you were looking at statistical data early, so Anonymous has asked, who has the WHO, World Health Organization, or other health organizations come up with a definition, like a definite one, of long COVID and or the symptoms? Is that something we can answer? Do we know?
Yeah, so I can answer that. So the CDC has a definition of long COVID on its website, and I also shared it during my presentation, and it lists some of the symptoms of long COVID, but like this is, very new for the researchers also. So the symptoms are not like whole, like there can be new symptoms as well. So it says that new symptoms. And I can share the CDC's definition in the chat.
And I know that the National Academy of Sciences fairly recently was convening some people to try to solidify a formal definition of long COVID. So I think it's something that will be evolving. But as Shreya mentioned, the CDC has settled on a definition and is using that in their national household surveys. Healthcare claims data, there is now an indicator for long COVID. So the pieces are starting to come together.
I also see a note in the chat that there is no definition for long COVID and it's still syndromic. So thank you for sharing that. So we have another question from a participant who was asking about if we considered worker health and well-being in the research design, and if we would consider having outcome measures related to self-reported health status and well-being. That's a good question. We did not focus on health as much because our target population was individuals who had experienced disabilities. And we may be focused on a more narrow dimension of well-being, which is, we looked at engagement and self-efficacy. It's not quite the same, but we did not specifically look at well-being, only because there's this whole world of options when it comes to outcomes that we could look at. We had to make sure that our participants weren't overburdened when we asked them 5 different questionnaires, so we had to be a little selective in choosing our outcomes. But maybe in the future we would definitely think about expanding or looking at slightly different outcomes. So thank you for that.
And Shreya has put into the chat the definition of what from the CDC. And in case anyone wants to click on those and check them out. So I guess one of the, there's a new question that just came in.
So we have another question which is asking, how broad will you be looking for people with disabilities as well as long COVID? Is it regional or is it national? And that we mentioned the aspect of focus groups, for example. So our previous study and our current study, we looked at a nationwide recruitment plan because our coaching happens, over the phone or using teleconference by Zoom. So we were able to reach beyond our regional, location and recruit from across the nation. The current focus group that we have planned will also have a national reach. Those focus groups will be held through Zoom electronically, and we will be able to recruit participants from across the US. Once we have IRB approval, we don't have that. We're still waiting for that. And once we have that, we should be able to do that. Thank you.
There's a couple of questions that just came in. One is, will there be any involvement of people who are now disabled due to long COVID in any of your studies?
I can answer that. Our priority was people with disabilities who got long COVID. But we do understand that now there's a larger population who, have a disability due to long COVID. We'll see how our focus groups evolve. At the moment, we're planning to involve people with disabilities who have a disability in addition to long COVID, which we understand can be disabling as well. I think there was another question that disappeared, or did someone answer that? I think someone had a question about how people with disabilities might advocate for themselves in the workplace to protect themselves from getting long COVID, because as we know, COVID is still circulating around. That's not a focus of our particular studies, but I think, it might be something, accommodation wise, that you could work with your supervisors and your HR to talk about those protections. And, long COVID is also recognized as a disability under ADA now, so that might help in terms of accommodations that you can receive.
I think we're all reading the comment that came in, the question that came in.
Hi, Nanette. So there's a question about, is there a significant difference in impact between people who have symptoms for 4 weeks and those who are likely to have it forever? And do we have any estimates of the forever group? We don't at this point. The definition we're working with for long COVID is whether people have had symptoms for 3 months or longer. We haven't really teased out yet anything at finer detail than that. But it could be something we could bring up in our focus groups to try to get a sense from people.
And I mean, it's still evolving understanding what long COVID is in some ways, I'm sure, because people are still getting COVID. And is it really long COVID forever, or will it ever end? We have about 3 minutes left before we will end for the afternoon. While we wait for any other last questions, was there anything that any of the three of you would want to say in the last few minutes?
So I'd like to thank NIDLR again for their support for this research and everyone's interest. There will be slides available to everyone and a recording probably posted in early December. And if you have any specific questions, you can certainly reach out to us. Our contact information is included on the slides.
Yeah, I want to echo Deb's statement that we're really grateful that NIDLR recognized the need for research in this area, and that we have this opportunity and this resource to sort of dig deeper into people with disabilities who experience long COVID. It is, evolving, but we're excited to be at the forefront of this area and add to the knowledge base.
Thank you all very much for this terrific presentation. And there's some very nice suggestions in the chat for future collaborations. Please do come to our sector website. You will see the posting of the webinar there and the recording of the webinar, and contact us if you would like more.
And yes, we would really appreciate it if you would take our brief post survey just to let us know what you thought of the webinar. We love that feedback, helps us improve, grow. And thank you everyone so much for being here. We really appreciate it. And thank you, Dr. Forber-Pratt, for joining us earlier today. And Dr. Hugh Berry, your project officer. And thank the three of you for being here.
And thank you, Sector, for hosting us and helping us get the word out. We really appreciate that.
Yes, we were happy to work with you guys. It's 2 o'clock, so I will be ending the webinar. It looks like there's one last comment in the Q&A that I can share later if you don't have time to stick around to read it. But thank you everyone, and happy holidays.
Thank you.